afternoon, Mr. Lamont. I'm from Home Health. I'm here to teach you about your Coumadin therapy with your recent diagnosis of atrial fibrillation, which is an irregular heartbeat that can cause clots and cause you to have a stroke or other issues. So the Coumadin is going to thin your blood to try and prevent those clots. I'm going to talk to you about your INR monitoring, your diet importance, and your bleeding precautions. Coumadin therapy, we go by a value which is called an INR in your blood, and it needs to be between 2 and 3 for a therapeutic level. That's our goal range. 2.5 is your goal. You can use a coag check monitor at home, and this is a picture of what it looks like. It's like a glucose monitoring test. So you would use these strips in here and then prick your finger with that, and it's just a little tiny blood that would show you your levels on there, and then you could report that to your doctor. With your INR monitoring, you're going to have a special person that will follow you that can monitor your dosage changes. So initially you'll be on 2 to 5 milligrams, and then eventually when we hit a therapeutic level, you'll be on 2 to 10 milligrams for a maintenance dose. It can vary, your doses can vary. You can take 3 days a week, 2 milligrams, and the other 4 days you can take 5 milligrams to make a therapeutic level. With your diet importance, vitamin K is the opposite of Coumadin, so it will clot your blood. So you want to keep your diet consistent with vitamin K. So eat the same foods. If you eat a salad 1 time a week, continue to eat a salad 1 time a week. Other foods that are high in vitamin K are broccoli, cabbage, kale, spinach, and liver. With Coumadin therapy, there's a lot of bleeding precautions. With a low INR, which is less than 2, your blood is thicker, so you're at higher risk for clotting. If it's greater than 3, you have a higher risk for bleeding. With Coumadin, you want to inform all your doctors and dentists that you're on the medication, especially if you get an injection or some type of procedure or any surgeries, because your blood's going to be a lot thinner, so you have a higher risk of bleeding. With your bleeding, you want to look for uncontrollable bleeding, like blood in your stool, excessive bleeding in your gums when you brush your teeth, and make sure to use a soft bristled toothbrush. You will have bruising. Even the slightest little bump on your arm will cause a bruise from Coumadin. But if you have excessive bruising or ones that won't go away or get bigger, make sure you notify your doctor. Nosebleeds, if you have any dizziness or fainting, Coumadin can cause bleeds inside your body that you can't see outwards. So your hemoglobin level could be low, which is your red blood cells, so that could cause you to be dizzy and pass out. If you have excessive nausea and vomiting for 2 days, like a stomach bug or anything like that, and you can't take your Coumadin, or for some reason you can't keep it down or anything, make sure you contact your physician, because they'll have to be aware of that for your dosages. Also, with taking aspirin, your Coumadin level could be much higher, so just be aware of that and keep consistent with your Coumadin. Make sure you take your same dose that you're prescribed every day. If you miss a dose, don't double up the next day, just continue with your regimen. Do you have any questions for me?
Yeah, so you were saying that 2, my blood is thick, 3, my blood is too thin. So what are we shooting for as far as a number?
2.5 is the goal for.
That's the goal we want.
For your blood to be at the correct thinness, if you want to say in easy terms.
Now this is something we have to take every day?
Yes. You want to take it every day, and it's really important if you can't, get it filled or, insurance reasons or anything like that, to notify your physician that you can't get the prescription, or if you weren't able to take it, like I had said, if you were ill.
Okay, now, how long will I be on this stuff?
You'll be on this for a lifetime. With the irregular heart rhythm, you'll have this for a lifetime, so you would definitely want your blood to be thin forever, so that you don't potentially have a clot, cause a stroke or anything like that.
Okay. Now, is there a set time of day, or?
We typically like people to take it in the afternoon. Usually 4 or 5 o'clock is the goal range to take it, so take it with dinner time.
Okay. Now, getting back to foods you were talking about, like liver. Is that good or bad for me?
That's bad. It's high in vitamin K, so you want to avoid things. The main thing that we tell patients is green leafy vegetables is what your issue is.
Okay. Do you have any questions?
How often does he have to have the blood work?
Monthly. In the beginning, when he initially starts it, they may want it like weekly or every 2 weeks. If he would go in one day and his, INR is 4, they may want to see him back in a week to make sure it's down because of the bleeding risk, or if it's too low. Until you get to that stabilized between 2 and 3, you're gonna want to go more often, depending on what your doctor prescribes. But once you're stabilized and have a therapeutic level, you'll go monthly for blood work.
And if we get the home monitor, do we have to do it monthly also?
Yes. And
No.
you definitely want to make sure you report that with your doctor, or there's a lot of times there's nurses out there that deal with just Coumadin levels for all patients, so they'll monitor that and they can adjust your doses.
Okay.
One last question. Physical activity, any restrictions?
Nope, just be careful with if you do anything with like hit your legs or anything like that, or beat yourself up on anything, to make sure you watch for bleeding.
Okay.
You'll have
Thank
to be
you.
careful in the workshop.
All right.
Thank you very much.
Thank you.
Thank you.